Star Syringe's groundbreaking ID syringe is designed for the rapidly emerging world of intradermal delivery of vaccines, therapeutics and diagnostics. Star's easy-to-use ID syringe features an adapter with a narrow-gauge mini needle, barely more than 1 millimeter long. The syringe element has a game-changing narrow barrel that creates the high injection pressures required to administer via the narrow-gauge mini needle. Safety features include a Sharps injury prevention plastic spike, as well as an auto-disable mechanism. Star ID is compatible with all vial and ampoule sizes. This video is for educational purposes only. Please ensure that your procedure is best practice. Always review and observe your national policies before undertaking any procedure. Hand hygiene. Be sure to wash your hands before starting your injection routine. This is good hygiene practice. Skin preparation. Skin preparation is also important. Prepare the skin at the injection site using an alcohol wipe. You may also need to use soap and water. Syringe preparation. Check that the syringe package is unopened and undamaged. Check the expiry date. Discard any syringe if opened or damaged or beyond the expiry date. Peel open the package and remove the syringe. Be careful not to depress the plunger. This will disable the syringe. Star ID syringe has a safety feature which must not be activated at this stage. Preparation of medication. Clean the vial stopper with alcohol and allow it to dry. This will take a few seconds. Then remove the transport cap from the syringe. Insert the syringe's plastic spike into the vial. Ensure that the spike is completely immersed in the liquid before filling the syringe. Slowly pull back the plunger to fill the syringe to the required volume. The cone shape above the plastic disc closest to the spike should be lined up with the fill line in the broad part of the syringe barrel. It is important to note that no liquid will enter the broader body of the barrel. The medication dose will always remain in the narrow upper section of the barrel. Withdraw the syringe from the vial. Once again, please remember not to push or pull the plunger when removing the syringe from the vial. Place the vial upright to one side. Intradermal adapter preparation. It's now time to open the adapter package. Check that the adapter package is unopened and undamaged. Check the expiry date is valid. Discard the adapter if opened or damaged or beyond the expiry date. Peel open the package and remove the adapter. Holding the syringe in one hand, align the open end of the adapter with the syringe. Locate the adapter over the spike by aligning the two lugs with the two slots on the syringe collar. Then firmly push the adapter and syringe together until you hear a click. When next to the patient, hold the sides of the adapter lid between thumb and index finger and lift the lid open. Remove any air bubbles by holding the syringe upright. Gently tap the barrel to move the bubbles towards the tip of the syringe. Expel any air bubble by pushing the plunger to the dose mark. Injection procedure. Hold the syringe at a 90-degree angle, a right angle, to the patient's deltoid area. Insert the needle into the deltoid region in a short, quick movement. Maintaining a light pressure on the surface of the skin, Administer the injection by fully depressing the plunger. Withdraw the needle from the patient. Push the back of the hinged lid to close the adapter. Fingers must be kept behind the needle at all times. Immediately after use, dispose of the syringe in a sharps box. Star Syringe's ID syringe, a new milestone in intradermal delivery.